Citalopram, Celexa, uses, dosage, side effects, and safety tips. Citalopram, marketed under various brand names globally, is a widely prescribed antidepressant belonging to the selective serotonin reuptake inhibitor, SSRI, class. It is most commonly used for managing major depressive disorder and certain anxiety-related conditions, offering symptom relief typically within 1 to 4 weeks of consistent use. In India, the most well-known citalopram brand name in India includes Celexa, Citral, and Cytalic, among others, ensuring broad accessibility. What is citalopram? Citalopram, also known as Celexa, is an antidepressant that belongs to the selective serotonin reuptake inhibitor class. Severe depressive disorder, obsessive-compulsive disorder, panic disorder, and social phobia are all handled with it. It may take 1 to 4 weeks for the antidepressant effects to appear. What are the benefits and uses of citalopram? Citalopram helps restore the balance of serotonin in the brain, which can uplift mood, improve concentration, and reduce anxiety. As a first-line SSRI, its tolerability profile makes it a preferred choice over older antidepressants. Conditions citalopram treats: major depressive disorder, MDD; generalized anxiety disorder, GAD; obsessive-compulsive disorder, OCD; panic disorder and social anxiety disorder. Off-label/secondary uses: premenstrual dysphoric disorder, PMDD, post-traumatic stress disorder, PTSD, and neuropathic pain in some cases. Secondary uses of citalopram: management of chronic pain syndromes, off-label; adjunctive therapy in treatment-resistant depression; irritable bowel syndrome with comorbid anxiety. How does citalopram work? Citalopram selectively inhibits the reuptake of serotonin, 5-HT, at the presynaptic neuronal membrane. By blocking the serotonin transporter, it increases serotonin concentration in the synaptic cleft, which enhances serotonergic neurotransmission. In simple terms, it allows feel-good and chemicals to remain in the brain longer, improving mood and reducing anxiety. Because citalopram is formulated as citalopram hydrobromide, it dissolves readily and is absorbed efficiently when taken orally. This hydrobromide salt ensures consistent bioavailability. How to use citalopram HBr. Before taking, read the prescription guide and patient information leaflet. Consult your doctor or pharmacist if you have any questions. Directions to take citalopram HBr. Take the medication regularly for best results. Take it at the same time every day to help you remember. Keep taking the medication even if you feel well. Do not stop taking it without consulting your doctor. Abruptly stopping can worsen your condition and cause symptoms like mood swings, headaches, tiredness, sleep shifts, and electric shock-like sensations. Your doctor may gradually reduce your dose to prevent these symptoms. It can take 1 to 4 weeks to notice a difference. Full benefits may take several weeks. Citalopram dosage. Citalopram dosing should always follow a healthcare provider's instructions. Improper dosing can lead to subtherapeutic response or increased risk of side effects. Typical dosage instructions, as per doctor's advice. Starting dose: for adults, the usual starting dose is 20 mg once daily, either in the morning or evening, with or without food. Titration: after 1 to 2 weeks, the dose may be increased to a maximum of 40 mg once daily, based on clinical response and tolerability. Lower doses: in patients with hepatic impairment, older adults, or those taking interacting medications, a lower starting dose of 10 mg, citalopram 10 mg, once daily may be prescribed. Citalopram 10 mg, often used as an initial dose in elderly patients or those at higher risk of QT prolongation. What should I do if I miss a dose? If you forget a dose, take it as soon as you remember unless it's almost time for the next dose. Do not double up doses to make up for a missed one. What happens if an overdose? Symptoms of overdose: severe drowsiness or dizziness, rapid or irregular heartbeat, nausea and vomiting, tremors, confusion, or seizures. What to avoid an overdose? Do not induce vomiting. Avoid taking any additional doses. Seek immediate medical attention or contact poison control, as overdose can be life-threatening if not treated promptly. What are the side effects of citalopram? Most side effects are mild to moderate and tend to improve over time as the body adjusts to treatment. Common side effects: nausea, dry mouth, and sweating. Fatigue, drowsiness, or insomnia. Headache and dizziness. Sexual dysfunction, e.g., decreased libido, delayed orgasm. Weight changes, gain or loss. Serious but rare side effects. QT prolongation may lead to arrhythmias, more common with higher doses. Hyponatremia, low sodium levels, especially in elderly or on diuretics. Serotonin syndrome, when combined with other serotonergic drugs, signs, agitation, confusion, rapid heart rate, hyperreflexia, shivering. Severe allergic reactions, rash, itching, swelling. Citalopram side effects in females. Menstrual irregularities or heavier periods, rare. Increased sweat production. Potential weight gain that may be more pronounced in some women. Patients should discuss any persistent or worsening symptoms with their doctor. If you experience chest pain, fainting spells, or irregular heartbeat, seek medical help immediately. Essential precautions for using citalopram. 1. Allergies. Inform your doctor if you are allergic to citalopram, escitalopram, or any other substances. Inactive ingredients may cause allergic reactions or other problems. 2. Medical history. Inform your doctor about any personal or family history of bipolar/manic depressive disorder, suicide attempts, liver disease, seizures, low sodium levels in the blood, peptic ulcer disease, glaucoma, angle closure type. 3. Heart rhythm disorder. QT prolongation can cause serious, rarely fatal, fast/irregular heartbeat and other symptoms, e.g., extreme dizziness, fainting. Risk may be increased with certain medical conditions or medications. Low potassium or magnesium levels can also increase risk. 4. Drowsiness and blurred vision. Citalopram can cause drowsiness or blurred vision. Alcohol or marijuana, cannabis, can exacerbate these effects. Avoid driving, operating machinery, or performing tasks that require alertness or clear vision until you are sure you can do so safely. Avoid alcoholic drinks and consult your doctor if using marijuana. 5. Older adults. More susceptible to side effects such as bleeding, loss of coordination, and QT prolongation. Higher risk of hyponatremia, salt deficiency, especially if taking diuretics. Increased risk of falls due to lack of control. 6. Children. More vulnerable to side effects such as appetite loss and weight loss. Monitor weight and height in children taking this medication. 7. Pregnancy. Should be taken during pregnancy only if absolutely necessary. May harm the unborn child and cause withdrawal symptoms in newborns if taken during the last 3 months of pregnancy. Consult your doctor about the risks and benefits of taking citalopram during pregnancy. 8. Breastfeeding. Citalopram can pass into breast milk and may have adverse effects on a nursing baby. Consult your doctor before breastfeeding. Are there any age restrictions for using citalopram? Children and adolescents, less than 18 years, increased risk of suicidal ideation. Use only if benefits outweigh risks. Monitor closely during initiation and dose changes. Older adults, more 65 years, higher sensitivity to hyponatremia, bleeding risks, falls, and QT prolongation start at 10 mg/day. Alcohol or food interactions. Alcohol may exacerbate drowsiness, dizziness, or cognitive impairment. Strongly advised to minimize or avoid alcohol intake. Marijuana, cannabis, can increase sedation or impair cognition. Avoid until you know how both affect you. Grapefruit juice. Although not a major inhibitor of citalopram metabolism, Excessive intake may still impact blood levels. Moderation is key. Possible interactions with other medications, drug interactions. Citalopram can interact with several drugs, supplements, and herbal products. Always consult your healthcare provider before combining therapies. Common drug interactions. MAO inhibitors, e.g., phenelzine, tranylcypromine, contraindicated, risk of serotonin syndrome if combined. Other SSRIs/SNRIs, e.g., sertraline, venlafaxine, increased risk of serotonin syndrome, avoid overlapping therapy. Tricyclic antidepressants, e.g., amitriptyline, may increase QT prolongation or anticholinergic effects. Antipsychotics, e.g., haloperidol, potential additive QT prolongation risk. NSAIDs/antiplatelets, e.g., ibuprofen, aspirin, elevated risk of gastrointestinal bleeding. Monitor for signs of bleeding or bruising. Warfarin, citalopram can potentiate anticoagulant effects, monitor INR closely. Digoxin/lithium, may increase serum levels. Monitor drug levels and clinical response. Supplements and herbal products. Street John's wort, can cause serotonin syndrome when combined with citalopram, best to avoid. 5-HTP or tryptophan supplements, risk of excessive serotonergic activity, avoid without medical supervision. Omega-3 fatty acids, generally safe, but inform your doctor to keep track of overall drug regimen. How should citalopram be stored? Store citalopram in its original container at controlled room temperature, protected from extremes of heat, light, and moisture. Keep all medications, including citalopram, out of reach of children. Recommended storage temperature for citalopram. Tablets. Store at 20 degrees Celsius to 25 degrees Celsius, 68 degrees Fahrenheit to 77 degrees Fahrenheit. Allowable excursions, 15 degrees Celsius to 30 degrees Celsius, 59 degrees Fahrenheit to 86 degrees Fahrenheit. Liquid suspension. Similar room temperature guidelines, tightly cap when not in use to prevent evaporation or contamination. What happens if citalopram is not stored properly? High heat/direct sunlight may degrade the active ingredient, reducing efficacy. Excessive moisture, e.g., bathroom, can cause tablets to deteriorate, change in consistency, or lose potency. Freezing temperatures, liquid suspension may separate or become unusable. Loose containers, increases risk of spills and accidental ingestion, especially by children. Keep away from children/pets, store high on a shelf or in a locked cabinet. Sunlight, choose a dark, cool cabinet rather than a bathroom shelf. Moisture, avoid storing near sinks, dishwashers, or bathtubs.